Ariel, Ruby, let's go. Let's go.
Come on, let's have a candid conversation. Let's talk about it. Just bring it up, we got hope and love.
Yeah.
It's all about you and your well-being. The candid conversation show. Let's go, let's talk about it.
Hey, let's talk, let's walk it out. Let's talk, let's walk it out.
It's all about you.
Walk it out.
You know that this is Breast Cancer Awareness Month.
19 years ago, I actually was diagnosed with breast cancer.
Okay.
I found this lump in my breast, and for years I've always had fibrocystic,
Okay.
and it was always, just
Benign.
fluid in, the pockets there, and then went away. But this time I actually went to my doctor and said, I got this lump, and they did a mammogram and everything, and
Okay.
everything came out normal. She said, well, just probably stop using deodorant,
Yeah.
and it'll probably go away. So a week went by, and I was just like, something is just not right. It felt that, in my gut.
Right.
So my boss at a company I was working at, he said, if something is bothering you,
Get it
then
checked.
something is wrong.
Yes.
So he referred me to his surgeon, and I went to him, and he looked at my mammogram films, and he didn't really see anything, but he said, I want to have you have a biopsy.
Okay.
So when I had the biopsy done, and he actually felt the lump there, and they did a needle aspiration,
Yes.
nothing came out, which was a red flag, because usually fibrocystic fluid comes out.
But nothing came
Nothing came out, so they did the other biopsy, and then that evening they called me back and said, I need you to go back because we want to test another area. So I went back, they tested, and then a few days later I went back in the office, and I heard the most 3 frightening words that nobody wants to hear, and that's, you have breast cancer. And my head was spinning
Yes.
like a tornado. It's just like I'm hearing this, that, and
Right.
trying to comprehend, and it's just like,
What?
did you just say?
Yes.
It's like, you have breast cancer. And my next question was, how much time I gotta live?
Right. Oh.
He's like, whoa, wait a
Yes,
minute
yes.
now, slow your roll. We
Right.
haven't even got there
Right.
yet,
Right.
so.
You started to panic.
Yeah, panic, and then I said, I got young kids, I
Yeah.
can't die, and and he's like, well, we may have to remove your breast. I'm like, no, I like my tatas, and he said, well, it's gonna be okay, we gonna get through it.
Okay.
And actually, my coworker, he came with me,
Okay.
and he's from Spain. His wife actually had breast cancer,
As well. Okay.
but she didn't. She opted not to have her breast removed. I just went through chemo, and then
Right.
10 years later came back, and she passed away.
Okay.
So
sorry to
when
hear
he
that
came to
one.
me, and he was just like, no, you gotta
Yes. Remove it.
do it, because I wish I could have, told my wife and instilled that to do that. So got through the surgery and everything, and when I woke up, my surgeon was standing over me, and I'm just like, am I in heaven?
Yes.
Am I still
Am
here?
I still here?
He's like, yeah, you're still here. We got it all, and I was just like, it was just a relief with that. But it was a rough road, and they actually removed 20 out of 20 out of 23 lymph nodes. They caught it before it actually hit my lungs.
Oh my gosh.
So if I didn't listen and just,
Right.
figured it was, using deodorant,
Exact.
probably more, I was stage 2B.
So tell me about the deodorant. What is the story with the deodorant?
It had nothing to do with it. It was already getting it, because it started in my breast.
Yes.
And once it hit the lymph node, it started spreading.
Okay.
And the lump there was one of the lymph node that the cancer was in.
They were thinking maybe you were allergic
Yeah,
to the...
because sometimes they say you deodorant,
It's
you might
true,
have an
yeah.
irritation that could cause your lymph nodes to swell.
Oh, okay.
Yeah.
Okay. I got it.
So with that, and I started, the chemo radiation again. That was a rough road because made me sick.
Yes.
And they say the toilet bowl was like my best friend because I hugged it so
Yeah.
much, and and
Is it like a pregnancy sick? You know how when you're pregnant, you have the
it's
morning
worse.
sickness?
It's worse than that.
Okay.
I even lost my taste buds, and actually my sister, because she was diagnosed with lymphoma cancer.
Okay.
And it was 6 months later I was diagnosed, and she lived in Pompano, and she used to, they had a patio, And she was like, oh, I smell the bird in the tree. And we look at her like, is she crazy?
Right.
And it's like, no, there's a bird in the tree. And we're just
wow.
like, okay. If you say, all of a sudden we hear the bird chirping,
There's a bird in the tree.
you know. And then when I went through my chemo, it's like your senses
Okay.
is like magnetized like a million, because I could open the fridge, I can tell you that's bad,
Yes.
that's going bad, you know. And even taste buds, I lost all my taste
Oh my
buds.
goodness.
That even chewing meat, it was
Okay.
just like chewing like they just killed the animal.
This is from the
Right.
chemo or from
Yeah.
the radiation?
From the chemo.
Chemo.
And then rice was like cotton in my mouth. And one day I had this craving for some escabeche fish and rice and peas. I went
That's
to a
right.
Caribbean restaurant and I couldn't taste it. And I went and put some Scotch bonnet pepper.
Right. Yeah.
I mean, I literally poured the whole bottle.
And you still
And you
couldn't
know
taste
how
it?
hot that is.
Right.
And I still could not taste
Oh,
it.
gosh.
So my mother ended up bought a juicer
Okay.
and juice, you know, like carrots and celery and beets, and that's what I mostly, you know, drank. And then we did Ensure and
Okay.
put protein powder, and
Okay.
and
So you
that
can
was
have some
it.
type
Yeah,
of nutrients.
with that. And even though they gave me a little pill to put on your tongue for the nausea, it
Okay.
still didn't
Didn't work.
do anything. And then yeah, after the radiation, I mean the chemo, I started with radiation just to kill that area.
Okay.
And that wasn't too bad. It does tire you out, because for me that normally would take you maybe 10, 15 minutes to take a shower, it would take me an hour, because I'd be so out of breath
Yes.
and stuff. And I mostly did after the chemo, my mother's old-fashioned again, with the aloe
Okay.
and put on the area, and all I got was a nice tan and tissues weren't damaged, and I was able to get, you know,
helped a
reconstructive
lot.
surgery and had nice and nice boobs.
That aloe,
So-
that's a good one.
Yeah, and you
I
know,
don't think a lot
aloe
of
is
people
good
know
for
that.
everything,
Yes, it is.
you know.
I remember we grew up with that.
Yeah.
Old school.
How long was the chemotherapy and the radiation?
It was about a year.
Mm.
Yeah.
So are you still taking pills or anything?
No, after that, you go on. I was on tamoxifen for
Yeah.
like 5 years, and then after that, they say after 5 years, then you're considered
In
a
remission.
cancer survivor.
Yeah.
You know, with that, and
Yeah.
it's been, you know, ongoing, and you know, surviving still 19 years later and stuff. But you know, I just continue to educate myself and try to eat the right foods
Yes.
and try to keep in positive, you know, spirit.
You have to.
And so-
You don't just educate yourself, though. You educate other women.
Oh yeah,
She educates
Yeah.
everyone.
yeah.
Everyone. You talk about it.
Yeah, and I have friends that call me that, you know, say they have someone's going through, you know, cancer or, you know, this condition and stuff. And, you know, no matter what condition that we go through,
Right.
the mentality is still the same. We go through depression.
Yes.
One day we're laughing, the next day we're crying,
Yes.
and the next day we're depressed, and the
Roller
whole 9
coaster.
yards. Yeah,
Emotional
yeah,
roller coaster.
Yeah.
So tell me, how did your family feel about this when they found out?
It was kind of difficult on my mother, because, you know, you got your oldest child and then you got your youngest child going through it. But, you know, she just, you know, pushed through, and, you know, that's motherly love, and just, you know,
Yes.
supported us. And she was actually there, you know, for me and helped me take care of my kids. And
Okay.
there's many days that, you know, part of that, you know, depression I was going through, and, you know, mental illness, that at one point I wanted to kill myself.
Yes.
Aw.
And I said, if it wasn't for my children, I
wouldn't
probably, if
be
I had a
here.
gun, I probably would have shot myself. I said, I can't do this.
Yes.
You're going
It's
through
just
so
constantly
much.
sick all the
It was
time.
over. Yes.
So my kids would come in the bathroom and, you know, play their toys and read their book.
Yes, they
And,
wanted
I
to
mean,
be
we
near their
love
mommy.
you, you're okay, and give me hugs and kisses. And it's like, you know what? I got to keep pushing through.
You have to keep
Right,
pushing
you know,
through.
and here you are,
Yeah.
19 years later.
Yeah.
You're a survivor.
Tell us
you.
about the 4 S's that helped you when you had breast cancer. You talk about 4 S's.
Self-esteem. Oh, God, it's like my mind.
Yeah, I know. Was it self-love?
Self-love. Self-love was the
Self-awareness.
biggest one. And the reason why I say that is because after having your breast removed, and I was dealing with, you know, one arm bigger than the other because of the lymphedema,
Okay.
and you lose your hair, and I didn't like who I saw in the mirror.
Yes.
And it was my surgeon's nurse who told me, she said, you have to get past that.
Yeah.
And I said, I feel less of a woman.
Yes.
And she's like, no matter what you go through or what parts of your body you
Still a
lose,
woman.
you're still a woman.
Yes.
And she said, I need for you to go home And when you feel right, stand in front of that mirror
Yes.
and strip naked and don't move until you like the person you saw in that mirror.
Still you.
And eventually, it took me about close to 6 months to really do that because I do a little at a time. And so
Yeah.
eventually that, and then I had all this another demon I was
Yes.
dealing with because my arm, I was like hearing, like somebody talking. It's like, why is her arm big? Why is it? And I used to cover up
Yes.
till I got over that fear.
Okay.
And I just started wearing sleeveless. I said, you know what? I don't even care.
Yeah.
To a point where nobody asks me anymore about it. So self-love was really the biggest thing. It was a renewal.
Yes.
Because someone asked me what was my greatest loss. And I said that was my greatest loss of losing myself.
Yes.
But it was my greatest gift of
Yeah.
finding
Finding
who I
yourself.
was on the inside.
That's right.
Beautiful.
That's beautiful.
Yeah, it is beautiful.
Yeah, so that's things we teach women. Part of what I do is, you got to love yourself first.
Coming from the community that I grew up in, there wasn't a lot of education on breast cancer. So, but I knew just because of my community and my family that it was time for me to start having mammograms when I was about 40 years old.
Right.
Good.
And so I started having my mammograms, and this one particular year, in between my mammograms, I was supposed to go bowling on like a Thursday night, and I decided not to go because my daughter had a special project. And I did a self-exam. Just, I don't know what made me do it. I said, gift of God, I think.
Right.
So I self-examined my breast area, which they always encourage us to do.
Absolutely.
And I found a lump. And it's ironic, I think about it now, is that, I immediately knew something probably was wrong. And I think that was my first sign, is that I knew that something was wrong. And so, of course, that's where I decided to call my
this checked.
doctor. It's time to get it checked, yes.
So what stage breast cancer were you diagnosed with?
I was diagnosed with considered between stage 2 and 3.
Okay.
What happened is once I was diagnosed, I went ahead and I contacted my primary care physician. My primary care she evaluated the mass, and she said, well, it was quite large. And she said, well, Katrina, it's movable, of course, but she wasn't a cancer specialist.
Okay.
So she said, well, she did give me great advice, go ahead and get a mammogram. You have to make sure you proceed further. And but again, I think that's when her saying that, it's movable. I don't believe it is. They gave me this sort of self-assurance that it's probably not cancer.
Right.
Yeah, it's benign. It's not cancer. And then, but I still took her advice.
Right.
And I went on and I had my mammogram. And then it was right there. They said to me, it doesn't look like, because I have dense breasts.
Yes.
They always had lumpy breasts. They always told me that. It's dense tissue there, so we don't think so, but let's move a little further. Then, of course, I had a sonogram done, and then there they said, okay, let's have a biopsy on it. So it's just one progression after the next. And then once I had the biopsy done, and went to my cancer specialist, it was on 4th of July, and they said to me, sorry, it's July 5th, and they said to me, I'm sorry, Katrina, but it was the most devastating news. I can't tell you how that can change your life.
Yes.
I can sit here and tell you 1,000 times
Yes.
that I can come to you and say that you have breast cancer. And until that day that it happens
Happens
to
to
you,
you.
will never understand how that feels. That is a feeling I can't even explain to you. Sorry.
Wow.
It's
No,
okay.
that's okay.
It's,
Wow.
it's life-changing.
Can't
Really.
even imagine.
And so I just remember
Wow.
I was by myself. So, and because I'm thinking that there was nothing, they weren't going to give me news that I had breast cancer.
Because you were
And
like,
they did.
kept saying, no, it might not be
Yes.
anything.
Yes.
Yes, you do not think they're going to tell you that until the day they do.
So you called your husband
Yeah,
right
I was
then and
like-
there?
And it was, I can laugh about it too. And I only cry because I reminisce about that
That day.
feeling, that day.
Yes.
And it will affect you for the rest of your
Your
life.
life.
But I can still rejoice in it, because
Yes.
I can
here.
recall the fact that how my spirit wasn't broken because of that. I was resilient. My friends in my community, they were just awesome.
You said, I'm going to
Awesome.
beat this.
Heck yeah.
And look at you, 3 years later.
3 years later. Yeah, I'm a survivor.
Yes.
I'm a survivor, yes.
That is beautiful.
Thank
Did you
you.
have to go through any chemotherapy or radiation?
I did. And I think the scare for me is that the day when I was diagnosed, it wasn't just that they said, you, with the biopsy came back positive, you have breast cancer.
Period.
They explained to me
Okay.
that the type of breast cancer that I had was triple negative. And there are like 3 receptors, or typically there are 3 receptors that are common among breast cancer. Mine is triple negative because my mass did not have any of those tissues.
Okay.
So what that means is that it can be a very aggressive form, and only chemotherapy is typically
will help it.
yeah, exactly, that
heal.
can eradicate it, and to hopefully to give you that lifelong expectancy. Excuse me, because it is the most aggressive breast cancer. The sad thing about that breast cancer is that it's very high rate for African American women. Triple negative is.
Oh my goodness.
And Barack Obama in 2016.
Tell them that. Tell them that.
I'm sorry.
I mean,
yes,
that's important.
Yes, it really is. It's the diagnosis of triple negative. It's becoming so common now among African American women, even women of color, Hispanics as well. And it's the most aggressive breast cancer. 20%, and it's probably the most rare, but it is the most aggressive, and it attacks women of color more than anything. And the survival rate is less with that type of breast cancer, triple negative. You look at a 5-year survival rate, it is the lowest among all breast cancers. So it's an aggressive breast cancer. And because typical breast cancers, you can take a 5-year pill to sort of keep it under control. Once I'm finished with chemotherapy, or I finish chemotherapy, then you have a waiting period. You just sit there for 5 years, hoping that it does not come back, because it's the one cancer that's the most, has the highest chance of reoccurrence. So, and it's the one that most African American women that we face. Yep.
Oh my gosh.
What type of side effects, because we hear some dreadful stories about chemotherapy, what type of side effects did you experience? Can you tell us that?
Oh, sure. I can tell you that the most devastating, and it's you having breast cancer is already devastating.
Of course.
But for me, it was like an invasion in your body. It was to the point where, your hair starts to fall out, because I went through what they call the red devil. It's a very aggressive chemotherapy, it's that potion. It's actually red.
Oh.
And I remember when the doctors brought it to me, they came, I thought they had NASA suits on, because I'm looking,
oh my gosh.
it's like, if they don't want to touch this, and why do I want it in my body?
In my body, yeah.
But I needed to survive. I had a family. I had myself.
Really?
Yes. And some of the symptoms, my taste buds, everything changes in your taste. My tongue turned black. My nails lifted. My nail beds were all black. My toes turned black.
Oh my goodness.
Yeah, your palms, your hand. Because really what chemotherapy does, it's actually a poison to the body.
Yes.
It poisons those fast reoccurring cells like hair and skin. It attacks those type of things, your tongue, your taste buds. So, yeah, and I had a little bit of radiation, but I had 20 treatments of chemotherapy. Yeah, and made you sick, very, very sick.
Sometimes.
Nauseous.
Yes.
Yes, I lost about 15 pounds. All my hair fell
came
out,
out.
eyebrows, my eyelashes. Yeah, everything is just, it stops there.
I think that's one of the days that I had seen you
Yes.
in the hospital, and I was like, oh my gosh.
Yeah.
What's going on?
Yeah.
I knew something was really happening.
Because you have to have, and it doesn't just start with just chemotherapy. Now, every 6 months, I have reoccurring doctor visits every 6 months.
To
have
check you.
Yeah,
Yes,
checkups. And,
Which is good.
yep, oncologist, and you have doctor after doctor. But I want to survive. So that's what I do. I make it happen.
Right.
Hold on a second. Is there a difference between the radiation and chemotherapy? Do you know?
Yes, well.
I don't know.
Yeah, and it's
Okay.
okay. Chemotherapy is actually an injection. I had a port placed in my chest, wall chest rather. Within that, they instilled all the potions and the medicines, the poison actually from chemotherapy. Radiation is actually, they concentrate on a small section and they radiate that section just to kind of shrink the size of it. But I also had a double mastectomy. So they decided, because of my mass was over 3 centimeters, they decided it was no option at all. They have to take the left breast, because I found it in this area here.
Yeah.
They had to take my left breast, and they gave me the option on the right side. And I just decided, because I didn't think I want to go back, just in case.
Right.
And I read about triple negative, and I knew what the causes and how it could come back.
Right.
I didn't want to have a second breast for it to attach itself to. But it's always a personal decision.
Yes.
I read and researched for myself, and I
went ahead
think
and
for
did it.
everyone, it's a personal
The
decision.
best. Yeah. So how did you feel about that? You know us as women, you know, the first thing we see when we look in the mirror, number one, is our hair.
Yes.
So here your hair starts to fall out. And then all of a sudden now you're doing away with your breasts. Tell me about those two situations. How did you feel with those two, the hair and then the breast?
Well, I'm sure we can all attest
Yes.
from the time we were kids. You know, we're mothers doing our
Of
hair.
course. Yes.
We're putting our Sunday best on.
Yep.
And those are things that, you know, you pride yourself on. And not that you're living life in vain, but those are things that are part of you.
Right.
You know, when I want my hair cut, I make the choice that you cut my hair.
Correct.
You know, so in this instance, I wasn't able. It wasn't my choice to make. And I think that was the part that was sort of devastating to me. It was like someone taking something from me without even asking me. But it wasn't even a choice. You know, it happened. And you know, in the beginning, you have those self-esteem issues. You know, you have, you know, you tie your head. I tied my head up, you know, and with scarves and hats, and but still, you know, at night I couldn't sleep with that hat. You take it off, and you still look in the mirror, and you look at your weight loss. You look at the fact now you have no breasts, and those things that what we proclaim made us women.
Of course.
Those things were no longer there. So, and I can tell you that it was mentally, it was self-esteem was shot, for lack of better words. It was just, I don't know, I went through, I think, a state of depression for a minute.
Of course.
You know, and I remember,
understandable.
even my oncologist, every time I went to a doctor's visit, they'd ask, are you okay?
Yeah.
Are you okay?
Right.
You know, you need to see someone, talk to someone. But again, I had my village, my family, my
Thank
friends.
God for that.
Yes, and it was just,
Wow.
you have to have a great support system. I don't care if it's you don't have family, if it can be your friends, if it can be your neighbors, someone. You have to have a really good support system because
Very good.
it's really tough going through it by yourself.
When you know that life is so short because you could have died,
Yes.
you are more willing to step out and say yes to any opportunity. And I was joking with a friend of mine. I said, hey, one day I think I'm going to compete. And she texted me back, how about today?
Yes.
And I was not ready for that. But I told her, you know, I had come through a season of depression. I lost my mom in 2018.
Sorry to hear that.
Thank you. I was diagnosed in 2016. So there had already been a lot of traumatic events that had happened prior to my mom passing. And then by the time 2019 rolled around and I came out of that depression, I said, I'm going to step out and do something. I actually discovered the breast cancer when I was doing a self-exam. I turned on the TV one morning, and it was a breast cancer special in the middle of June.
Okay.
And I thought, well, why am I watching this? And why am I still watching this? I could not turn the channel. And lo and behold, it caught my attention. Lo and behold, the pictures on the screen were showing you what breast cancer could look like. Discoloration, pain or redness, and a dimple.
Okay.
And when I saw the dimple, I didn't think anything of it. I just thought, well, let me go in the mirror in my bathroom and do my own exam.
Right.
I looked in the mirror and saw a dimple. But I thought maybe it looks like a cellulite dimple. So maybe it was a little, you know, fat pocket or something on my
no big
body. No big deal. And I turned to the other side, no dimple.
Yes.
That was a Saturday. On Monday, I was in the office, in my doctor's office. I didn't delay. And when I look back at the journey, I say, because I took quick action, it saved my life because I was stage 3 by the time I found that lump. So that's where the journey started. And you really don't get in to see your doctors and do all these tests right away. I knew that it was divine intervention. I knew I turned that TV on that morning to see that particular program at that exact time.
Yes.
And so that was how I discovered it. And I encourage women to do your self-exam,
Absolutely.
but also to make sure that you are paying attention to the signs. If you have pain, if you have soreness, if you have a dimple or discoloration, go see your doctor.
Yes.
Don't wait till you're 40.
Don't wait.
They say
Don't
wait
wait
till you're 40 to start having mammograms.
Exactly.
Don't wait till you're
Don't
40.
wait.
Go in.
Absolutely, absolutely. Go in, and it's the fear that keeps women from doing it. So I didn't get my mammogram 2 years prior to having the lump, finding the lump. My gynecologist said, "Candy, do you want to have a mammogram?" I was 36. I found the lump at 38. Had I done my mammogram 2 years, I might have caught it a little sooner. I'm adopted. So my gynecologist was encouraging me to do this because I didn't know my history. So they make exceptions for before 40. And I waited. but it was stage 3, and I caught it, because of the quickness of my
Yes.
action.
Thank
So,
God.
yeah, that's what I encourage women to do.
Did you receive any radiation or chemotherapy?
I actually did.
Mm.
I did the whole journey. I went from diagnosis to 6 months of chemo. I finished and I rang the bell in December of
Aw.
January 2016. I remember the moment.
Yes.
I went on to have a double mastectomy because it was on my right breast, but I didn't want it to
Of
come back.
course.
I have a 7-year-old daughter, and I wanted more than anything to be here.
Yes.
And I just went for it. Then, so I lost my hair, I lost my breasts. I felt like I lost my womanhood.
Of course.
And we don't talk about the trauma and what it does to you psychologically
Yes.
a lot. We focus a lot on what happens to the body. But after that, I had to do radiation.
Yes.
Of all the pieces of the process, the radiation was the hardest to deal with because of what you see. It wasn't painful. It was just a peeling off of your actual skin.
Really?
Wow.
It was. It peels off, and you have to look at it every day because you have to kind of keep it bandaged and keep it clean. So it was traumatic watching that happen, watching that process, and you just kind of push through it. But overall, that was not the end of the journey. It was then It was the reconstruction,
Yes.
and so there was a long 2-year process.
Oh, really?
2-year
2 years.
process, yes.
Let me ask this. When you went through the chemotherapy, what was the color? Was it burnt like a dark color?
So yes, the radiation, it starts out when you don't see anything.
Right.
So you start to feel like, oh, this is not going to be as bad. But by that, I'd say it was more than 8 weeks of radiation. Every single day for 20 minutes, you go into the doctor, 5 days a week. Then you get radiated. And it was pretty much black
Yes.
by the time they were done.
Because it was killing whatever.
It goes through. You're basically frying
Yes.
the area, the cancer, because they want to kill every cell that they possibly can.
You know, we didn't ask you that when you found out after having a mammogram and everything else that you had to have for them to diagnose you with that, how did you feel in that doctor's office that day? What went through your mind?
Well, when I tell people the story, I actually got the news over the phone. They don't normally do that.
Yes.
They will normally have you
Yes.
come into the office, but I had built a relationship with the nurse, and we were talking every day. Like I said, on Monday I got in for an appointment.
Okay.
By Thursday I had the biopsy, which a lot of people are fearful of the biopsy. Don't be afraid of the biopsy. They hear the word biopsy and they just feel like you're going to open you up.
Okay.
Really, it was just a needle. They go in, they take some tissue out to sample it,
Okay.
and it was done really quick. And so that is why by Friday I was diagnosed. But she called me and I was at work.
Wow.
Sitting in my cubicle in front of my phone, I saw the doctor's office number pop up, and I knew. I think you know,
Yes.
because something sunk in my stomach. I picked up, and she said, Candy, this is breast cancer. And I just felt like everything went silent for a moment.
course.
And the next thought, and I share this in my devotional, I said, well, God, you promised me long life.
Yes.
You promised me a purpose, a hope, and a future. So what are you going to do with this?
Now what?
I put it back on him.
Yes.
And I write about that in the devotional. And the steps from there was, this is something that will drive you to your knees. This is something that will cause your faith walk to grow
Yes.
very quickly.
Very.
And I just clung to the Word of God. I clung to my time with God. And that's where I got my strength
Yes.
from.
Oh, that's amazing.
Very good.
What did your husband say? How did you tell your daughter?
I know.
How, I mean,
I know. And I think about the road that they had to travel. No, we don't talk a lot about the support team.
yes.
Because a lot of the love and support comes to the survivor, the
Right.
patient.
Right.
But
The family.
I remember one day, funny that you asked me this, my husband said, I walked in the house, Candy, and you would be on the couch, recovering from chemo that I'd have to go every Friday.
Yes.
And he said, to see you, no hair, kind of like in the fetal position. I really didn't have a lot of sickness from the chemo,
Okay.
but it makes
Okay.
you tired.
Okay.
Yes.
And I would be laying on the couch, and he said, do you know what it's like to open the door, see you there, and not know if you're alive?
Oh, boy.
That put it in perspective for me, because he's a man's man.
Of
He's
course.
very strong.
Yes.
He was super supportive. He was Mr. Mom. He had to do it all
good.
when I couldn't do it. But to know that psychologically, more than what he physically had to do, the
Right.
cleaning, the cooking, and everything, he was exhausted, yes, but in his mind, looking at me,
Yes.
I felt strong
It took a lot for
inside.
him.
Yes.
I knew I was going to live. I had no other option. There was
Right.
no other option.
Right.
But that's what he went through, and that's what a lot of caregivers go through, and nobody really is supporting them because they're not the ones
Right,
in
going.
physical pain.
Everything is on you. All the focus is on you and helping you.
But I had a good support system, and my daughter,
Good.
she was a little younger,
Yeah.
so she was just looking at me, and if I smile, she's going to
She
smile.
smiled.
If I felt like strong, and even though I was going through it, she was feeding off of that, and so she became my strength. She did.
That's your reason.
Yeah, she's my reason.
Yeah.
She's my reason.
Yeah.
She's beautiful too.
Thank you.
Pretty little girl.
Thank you.
Do you feel that you'll have her do the genetic testing as well,
Well,
Veronica?
I'm glad you brought that up because there are different forms of breast cancer, and we don't really get in depth with that. And sometimes you'll see a program like the one that saved my life, and you really don't get a lot of information. So my form of cancer was estrogen positive.
Okay.
That means it was an estrogen-fed tumor.
Okay.
Along with that comes a lot of other things that I think about. What did I do wrong? How stressed out was I?
Okay.
And a lot of that played a part in this perfect storm, in this tumor forming. And they do the genetic testing, and that's how they find out if it's genetic or if it's something that's
Right. But it
hormonal.
wasn't.
Right.
So it wasn't for me.
Okay.
Thankfully, it's not something that's going to
Okay.
be passed on to her.
So
Awesome.
you mean to tell me that stress can do something like this? Stress can cause you to have cancer?
Part of this journey has been connecting with women and hearing their story. And somehow we talk about the medical side of it and maybe some genetic things, but there's a common thread that no one really talks about, and that is the trauma
Yes.
of a situation. Maybe it was something that was in a relationship.
Yes.
Maybe it was a divorce.
Okay.
Maybe it was rape. I've heard stories of women going through life trauma, and shortly after, they have
Gosh.
breast cancer.
Really? Oh my.
I heard a few studies that the cortisol levels in your body,
Yes.
when they stay raised over, I mean, that's a stress hormone. It's good because it's fight or flight. It's the thing that will get you out, get you
Yes.
moving if there's danger. But when you stay in a stressful state for too long, it breaks down your body.
It does.
And I know for a fact that I went through some very personal, hurtful things in my own life. 2 years after that is when I found the tumor.
Isn't that something?
Yeah.
Wow.
Stress induced.
It was stress induced. I believe
Wow.
that with my whole heart.
Yeah.
Mario, Ruby, let's go. Let's go.
Come on, let's have a candid conversation.